Thank you, Ian and Lucy. I'm now going to present slides about the effect of twin pregnancy on stillbirth and neonatal mortality rates. So in this year's report, we've decided to include a chapter looking further into the risk associated with twin pregnancy. This was to build on the findings from the confidential inquiry into twin pregnancies, which looked into the quality of care provided to the babies and the mothers in twin pregnancies. So, 2 in every 64 babies born are twins, and we know that these pregnancies are at higher risk of stillbirth and neonatal death. In the confidential inquiry, we found that in just over half of the twin pregnancies reviewed, the babies received poor care that might have affected the outcome, that is, contributed to the stillbirth or neonatal death. And in almost 2/3 of the twin pregnancies reviewed, the mothers received poor care that may have affected their outcome in terms of their future fertility, physical and emotional health. So this table from our new report shows the numbers of births and stillbirths for singleton and twin pregnancies over the 5-year period 2016 to 2020. I'm focusing on the data for the whole of the UK, but in the report we provide a breakdown for each UK nation. Over this period, there has been a 12% reduction in the number of both singleton and twin births across the UK, the top 2 lines of the table. However, despite this reduction in births, the number of stillbirths from twin pregnancies has remained stable, which has ultimately led to an increase in the stillbirth rate from twin pregnancies. So in the highlighted green section of this table, we can see that the stillbirth rate for singleton pregnancies reduced over the period 2016 to 2020 for the UK from 3.87 to 3.23 per thousand total births, whereas the rate of stillbirth from twin pregnancies has increased from 6.18 to 7.31 per thousand total births. This has meant that the gap between singleton and twin stillbirth rates is widening. And we show that in this graph here. So the difference between singleton and twin birth rates is shown. And in 2016, the difference was 2.31 per thousand total births. And this has widened to 4.07 per thousand total births in 2020. And you can see that the bars are getting wider apart. This means that the risk of twin stillbirth is over 2.25 times higher than for singletons. This widening gap between singleton and twin stillbirth rates could be partially due to a differential effect of the intervention programmes established to reduce mortality rates across the UK, with a lower impact on the prevention of stillbirths from twin pregnancies. If we now look at neonatal deaths, the picture is similar, with a reduction in the number of singleton neonatal deaths and the number of neonatal deaths resulting from twin pregnancies remaining stable. This again has resulted in the rate of neonatal death from twin pregnancies increasing over this 5-year period. Again, focusing on the green highlighted section of the table for the UK, we can see that from 2016 to 2020, rates of neonatal death from singleton pregnancies have reduced from 1.61 to 1.40 per thousand live births, whereas the neonatal death rate from twin pregnancies has increased from 5.32 to 6.2 per thousand live births. The graph here again shows the widening gap that's seen for singleton and twin neonatal mortality rates over this period, and the gap has widened from 3.71 to 4.81 per thousand live births. This means that the risk of twin neonatal mortality is almost 3.5 times higher than it is for singletons. As for stillbirths, this could partially be due to a differential effect of the intervention programmes, which have had a lower impact on the prevention of stillbirths and neonatal deaths from twin pregnancies. And we suggest that detailed investigation of the specific groups of twin stillbirths and neonatal deaths, where there are higher or lower differences than in overall rates, may provide some insight into new strategies to reduce mortality rates. So, if we then look at sociodemographic characteristics, we can see that the largest difference here in twin and singleton stillbirth rates is for the youngest mothers. This is at the top of the table. This is the youngest mothers aged less than 25 years. Twin stillbirth rates are as high as 9.8 per thousand total births. And as for singletons, there are increasing stillbirth rates with increasing levels of deprivation. And the twin stillbirth rate of 9.25 per thousand total births for mothers from the fourth quintile of deprivation is seen for the twin pregnancies. The youngest mothers, aged less than 25, and those living in more deprived areas have the highest difference in stillbirth rates, providing a group for whom new initiatives should be developed. Rates of stillbirth are similar for male and female babies, as seen in the top of this table. The largest difference in twin and singleton birth rate by ethnicity is for the mixed ethnicity group, where the twin stillbirth rate is 10.92 per thousand total births. This compares to 3.75 per thousand total births for singletons. The smallest difference is in the Black and Black British babies, where the rates of stillbirth are similar for both twin and singleton births at 8.09 and 6.88 per thousand total births, respectively. Further investigation of these differences may provide new insight into the types of strategies that could be developed to reduce mortality rates. Looking at gestational age and birth weight rates of stillbirth for twins, they're significantly lower for all preterm births and low birth weight babies compared to singleton births, as highlighted on the table in the blue boxes. For twins born at term, stillbirth rates were higher than for term singletons. Now we focus on neonatal deaths in terms of maternal age and deprivation, as we were looking the same groups as we were looking at for stillbirth. And the largest difference in twin and singleton neonatal mortality rates is once again for the youngest mothers aged less than 25 years, with twin neonatal mortality rates as high as 11.14 for mothers aged less than 20. And again, there are increasing neonatal mortality rates with increasing levels of deprivation, with a twin neonatal mortality rate of 7.89 per thousand live births for the most deprived quintile of mothers. So this identifies the same groups of mothers for the development of targeted interventions to reduce both stillbirths and neonatal deaths. Rates of neonatal death are higher for male babies, contrary to the finding for stillbirths. So for male babies, the rate is 7.08 compared to 5.17 for female babies. In terms of ethnicity, the highest rates for neonatal mortality are for the Black and Black British group and other ethnicities at 8.15 and 9.92 per thousand live births. As for stillbirths, detailed investigation of the specific groups of twin neonatal deaths, where there are higher or lower differences for twins versus singletons than in overall rates, may provide some insight into new strategies for reducing mortality rates, particularly for the Black and Black British babies, where we showed a much smaller difference in the stillbirth rates between singleton and twin pregnancies, a finding that is not replicated in neonatal deaths. The patterns of neonatal death with respect to gestational age of birth weight are similar again to stillbirths, with neonatal mortality rates for twins significantly lower for all preterm births and low birth weight babies compared to singleton births, as shown by the negative difference in the rates between singleton and twin rates. For twins born at term, rates for neonatal mortality were higher than for term singletons. So, in summary, our key findings for twin pregnancy were that there's been a 12% reduction in the number of both singleton and twin births over a 5-year period from 2016 to 2020. There's been an increase in both stillbirth and neonatal mortality rates for twins over the period from 6.18 to 7.31, and from 5.34 to 6.18 for neonatal deaths. The gap between singleton and twin stillbirths and neonatal mortality rates is widening. And in 2020, the risk of twin stillbirths was over 2.25 times higher than for singletons, and the risk of twin neonatal mortality was almost 3.5 times higher than for singletons. So compared to singletons, stillbirth and neonatal mortality rates for twins are significantly lower for preterm births and low birth weight babies. So our recommendation from this part of the report was that we should investigate the characteristics of stillbirths and neonatal deaths in twin pregnancies, particularly with regard to gestation at delivery, in order to understand the reasons for increasing mortality rates in this high-risk group. And we would target these actions at policymakers and research funders to put money in place to be able to carry out research to look into this in more detail.